name is Race Vora. I'm the medical director at the Fresno Madera Division of California Poison Control System. I'm joined today by a panel of experts, and I think the next slide has their names and titles. Dr. Craig Smolin is the medical director at the San Francisco Division of California Poison Control. Dr. Cyrus Rangan is a CPCS pediatrician and a medical toxicologist, also with California Poison Control. Dr. Giovanni Laird is a specialist in poisoning information with Cal Poison, and Dr. Rita Nguyen is the Assistant State Public Health Officer at CDPH. And all of us have been working together with our teams on an outbreak of Amanita mushroom poisoning. And I'm going to let Dr. Craig Smolin recap what's been happening since the last time we've updated the media about this issue. Go ahead, Dr. Smolin.
Thanks, Dr. Vora, and thank you all for being here today for this update. So since we talked, as you know, as many of you know, for approximately the last 7 weeks, the California Poison Control System has been tracking the largest outbreak of poisoning from ingestion of Amanita phalloides mushrooms, otherwise known as the death cap. Amanita phalloides poisoning is characterized by a delayed presentation of GI symptoms, so that includes nausea, vomiting, diarrhea, and abdominal pain that's then followed by progressive liver injury. And in some cases, that can advance to full hepatic failure, full liver failure, and potentially death. The earliest cases were reported to us on November 18th, and the most recent case was reported to us last week on January 4th. So now in total, we are aware of 35 cases. And just to put that into context for you all, in a typical year, CPCS may receive reports of anywhere between 0 and about 5 cases. The patients have ranged in age from as young as 19 months old to as old as 67 years old. Medical treatment for this poisoning has been provided in the following counties: Alameda, Contra Costa, Monterey, San Francisco, San Luis Obispo, San Mateo, Santa Clara County, Santa Cruz, and Sonoma. And I can say that specifically mushrooms have been foraged from locations in Castroville, Millbrae, Novato, the Oakland Hills, Pinnacles National Park, Santa Cruz, Santa Rosa, the Salinas area, Stinson Beach area, and some other unknown locations. We continue to see that all of these patients have either independently foraged for wild mushrooms or were part of a family or a group foraging for the mushrooms. That's to say that they didn't purchase mushrooms from a store or a farmer's market or a restaurant or any other vendor. Unfortunately, during this outbreak, there have been 3 adult deaths, and to date, there have been 3 liver transplantations. Currently, there is only 1 remaining patient who is hospitalized that we are aware of. That patient was the one who ingested mushrooms last week on January 4th, and unfortunately is quite sick and has significant liver injury. Just to recap some of the actions that CPCS has taken during this outbreak, we notified our partners from the California Department of Public Health and have released a public warning, a public health warning to all of the healthcare providers throughout the state of California, and we have an update of that warning coming out shortly. And in coordination with the Public Health Department, we have tasked both our public education and outreach teams with developing and distributing both press releases, educational materials, set up a dedicated web page that includes materials targeting many communities potentially at risk in this outbreak, translated into multiple different languages, including Spanish and Chinese and other languages. So in summary, we continue to see poisoning by Amanita phalloides mushrooms, and we anticipate that these mushrooms could continue to be fruiting in abundance throughout the rainy season in California. And we are urging the general public to avoid foraging for wild mushrooms at this time. And also urging our healthcare providers to really stay vigilant and to think about the diagnosis of mushroom poisoning when they're seeing patients who are presenting with symptoms that are consistent with it, or if they're showing any signs of liver injury, or there's any history of foraging for wild mushrooms. And so that's the update that I have, Dr. Vora, and I'll pass it back to you. I think you're on mute, Dr. Vora.
Sorry. Thanks, Dr. Smolin. We'll now turn to Dr. Nguyen with the CDPH. As you all heard, this outbreak is affecting many different counties and jurisdictions and many different locations, which is a great reason why CDPH is such an important part of this response. Can you talk a little bit, Dr. Nguyen, about how the state health department has been supporting this response and some of the steps that your teams are taking in order to help the public and also local health jurisdictions manage this outbreak?
Yeah, thank you so much, Dr. Ford. Just wanted to start off to thank our colleagues at Poison Control and all our partners throughout the state at the local health departments to react to and generate various content to help protect our communities. Um, as much as we are able to connect with Poison Control when the cases are identified, what's most important is that we even prevent folks from ingesting these mushrooms. And prevention and that message can be really hard to get out. So we really appreciate all of you here coming from the press to help highlight to folks just how dangerous things are right now in California. As Dr. Smolin had said, typically we get about 3 to 5 cases. The fact that we have 35 cases in a matter of 2 months is really very concerning. And it's a very deadly toxin, especially as people are ingesting and not recognizing how damaging that can be to the liver and how common it is to then proceed to actually life-threatening illness. So again, really appreciate the attention the press is bringing to this. I'm going to put into the chat a number of resources that we've helped develop in partnership with Poison Control and the local health departments to get messages out, to get folks to understand it's a really dangerous time to be doing mushroom hunting and foraging right now. It can be very hard, even for experts, to identify the difference between edible mushrooms and not. What we do know about the populations that are being affected, a number of them seem to be monolingual speaking, including Spanish, Chinese, Mandarin, English, English, but also Mixteco. We're seeing that a number of the patients do seem to have a Hispanic background, and so we're trying to get a lot of multilingual resources out. And so that includes a webpage that we've also launched at the public health side that's in English and Spanish. We have a translated version of that site in PDF. We've also created a number of video PSAs in English, Spanish, and Mixteco, since Mixteco has a challenge with a written form of language. Really want to give thanks to San Luis Obispo Public Health for collaborating with us on those resources. We've also developed a number of flyers in English, Spanish, and Chinese, as well as social media posts in English and Chinese. And so I'll go ahead and put all those links in a chat. As Dr. Smolin mentioned, we had a health advisory out to clinicians in December. We're putting one out again today because there's ongoing cases. This hasn't stopped. And similarly, we're going to be re-upping a press release later today to highlight that this is an ongoing outbreak and folks are getting very sick from ingesting these mushrooms.
Thank you, Dr. Nguyen. I know that we really appreciate the collaboration and all of the support from CDPH and your teams. I'll turn now to Dr. Cyrus Rangan to speak a little bit about poison control centers in general and how they contribute and add value to an outbreak situation like this, and really just what their day-to-day role is in safeguarding the health of Californians.
Great. Thank you very much, Dr. Vora. I'll start off by giving our toll-free number, which I'll repeat later as well. That's 1-800-222-1222. That's a number that you can call from any phone, from any location. And we are a 24/7, 365-day per year service. And we're a free service, and it's available to any member of the public. So whether you are at home and you have someone within your household who may have had a toxic exposure, or if you're a healthcare provider and you have a patient who may have come in contact with some kind of toxic exposure, we're available all the time to help. We have professional translation services available for any language as well. And we can help you determine the severity and the potential consequence of any toxic exposure that takes place in the home or elsewhere. we can then determine the need for whether you need to go into the emergency department or whether we, as poison experts, can help you treat the situation at home. And we cover just about any kind of exposure that may include medications, over the counter versus prescription medications, drugs, heavy metals, household chemicals, envenomations from spiders and snakes, and also, of course, poisonous plants and mushrooms. We want to also assure the public that all of your information that you discuss with us, your personal information and your health information, is kept confidential. And when you call us, you're speaking to specialized trained experts who will give you the up to the minute information on whatever it is that you're calling us about. So once again, that number is 1-800-222-1222, available 24/7, 365.
Thanks, Dr. Rangan. And one of those specialized experts in poisoning and poison control is Dr. Laird, who is on the call with us now. She's bilingual. She speaks Spanish. So for any of our media partners who have questions that they would like to ask in Spanish or have a Spanish language recap, we're more than happy to do that. So thank you, Dr. Laird, for being here to help with that. We'll go ahead and open up to questions, but I know Dr. Smolin wanted to make one more comment. I'm just gonna remind people, if you're not checking the chat, we are adding a lot of different resources in the chat, so please check those links, and I'll let Dr. Smolin go ahead and go. Go ahead.
Yeah, I just wanted to highlight a question that was in the chat and just make sure, just in case people aren't monitoring the chat from Metro newspapers. The question was, are the mushrooms toxic in any amount? And is there a safe, quote unquote, safe amount? And I just wanted to emphasize that there is no amount of Amanita phalloides that would be considered safe. A single bite of the mushroom could cause significant toxicity. And I also want to just stress that there's no cooking of the mushroom or freezing of the mushroom that would inactivate the toxin. So that is also, whether or not you cook it or don't cook it, you still will develop liver toxicity. And then finally, that you cannot tell the difference of this mushroom from other mushrooms by the way it tastes. It apparently is a good tasting mushroom, and so you're not going to be able to taste it and say, "Oh, that tastes terrible. That must be poisonous." So I just want to emphasize that point. It's a
One
very
more
important
question
point.
while we have you, Dr. Smolin. What's causing the spike in cases? Um, is there a good response to that? And
I,
then we'll take Manolo's question. I see your hand up. Thank you. Go
Yeah,
ahead.
thanks, Dr. Vora, for the question. I think that we know that there are certain years when there is an abundance of these mushrooms in the environment. The last time we had a major outbreak was in 2016. That outbreak was smaller than this outbreak. There was only 14 cases, I believe, that were reported. So this is quite a bit larger than that. And we do know from contact with our local mycologists and mycologists throughout the Bay Area that there are just a very large number of Amanita phalloides mushrooms fruiting at this time, making them very easy to find, number one. And there's a large, community of people who forage mushrooms for food. And these mushrooms may look very much like edible mushrooms in other parts of the world, and can easily be mistaken. And I think that is playing a role in some of these cases that's currently going on in this outbreak.
Someone asked if we have B-roll. We actually have slides that show the mushrooms, and we can share those if Naliza can show those slides. And I think that kind of drives home how subtle this can be, because on the left you see a mushroom that is edible or at least non-toxic, and then on the right you see the death cap mushroom. They're small, quite nondescript in my opinion, and then they resemble each other. And in dimly lit conditions out in the woods, they may not even look this different as they do here. They do look quite alike even on this photo, but people can be fooled, and we're being told by our mycology colleagues that even they have trouble sometimes distinguishing some types of death caps from non-toxic mushrooms, just depending on the life cycle, because it changes I think the next slide shows the life cycle, and this is something that we're sharing in the press release through CDPH as well. So you can sort of see that as the mushroom develops, and again, I'm not a mycologist, so please forgive my lack of knowledge about exactly what these different terms are. But as the mushroom develops, you can see that it changes shape and size and appearance. So there's not one stereotypical look to these death cap mushrooms, and they do look like other edible mushrooms, which is what gets people into trouble if they're used to foraging and they develop a sense of confidence or perhaps overconfidence, and then they unfortunately forage and eat these death cap mushrooms, then they get very sick, as Dr. Smolin described. And Manola has been waiting very patiently. Thank you so much. Go ahead with your question.
Yeah, thank you. And thanks everyone for your time to talk about this. Yeah, and I've heard as well that there's been specifically a lot of Spanish speaking individuals who've been impacted by this. I've heard from someone who speculated that it might be because a mushroom that someone who, might have immigrated here were familiar with back home, maybe they mistake it for that. So I was just curious if one of you could maybe speak to that a little bit more. Why it seems like Latinos are being more impacted by this. If you've heard a similar narrative, or just want to explain, yeah, why the people that are being impacted may be the ones that are impacted.
Yeah, sure. That's funny. I was actually going to jump in right before your question to say exactly what you were going to say is that we have heard in some cases the individuals relaying that the mushroom they collected it was exactly what you said, looked very similar to mushrooms that they would have normally picked and consumed in their home country. And in that case, it was somebody who was in the uh, Central American area. And so that that is a factor that we think is playing into this and why we have so many cases that are monolingual Spanish speaking, which is why we're trying to get the message out to these communities that now is a unprecedentedly dangerous time in California to do what might have been more like common cultural practices. The mushrooms here are different than the ones from home. And even just as a state, this is just very unusual. The last time we had a concerning outbreak was in 2016, and in that case, it was 14 cases. But now we're at 35, and it looks to be ongoing.
Yeah,
In
thank you.
addition, it's important. Yeah,
Oh, I
I
was
was
going to
just going
say,
to add to
yeah,
that. In
please.
addition, it's important to note that mushrooms that grow in different climates and different regions, they may have a lot of shared characteristics. And when you are looking at mushrooms, you may have poisonous mushrooms and edible mushrooms growing right in the same place, and they can still look alike and they can taste alike as well. So that's one of the biggest reasons why we get so concerned about people just going out and foraging for mushrooms because you never really know what you're going to get.
Thank you. The
And
last thing I wanted to clarify real quick was just, is it accurate to say that the culprit of all these poisonings is the death cap, or should I say most? I don't know if I saw very direct language about that in the press release, so I just wanted to make sure and see how you guys are describing that. And that's it for me. Thanks.
Yeah, that's a great question. I'll take a crack at it. There's several different varieties of mushrooms that contain the toxin. We call that amatoxin. So sometimes in toxicology, we just refer to them as amatoxin containing mushrooms. And death caps are the ones that are most commonly being found right now, is what our mycology colleagues are sharing with us. But they're not the only ones that are toxic. Certainly, there's other, unrelated varieties of toxic mushrooms out there too. But in the amatoxin-containing mushrooms, there's several different species that are known to be toxic to the liver. And in this case, the death caps are the ones that are fruiting most out abundantly right now, and the ones that cause the most problems because they look like the edible mushrooms that people might be used to eating.
There are a couple questions in the chat, Dr. Vora.
Oh yeah.
One question was, has California ever seen an outbreak this large? What I can say is, as Dr. Nguyen had just said, the last large outbreak was in 2016, and that was 14 cases. The CPCS has been in existence, I think, since 1999 in the way it's constructed now. And I can say that in those 26 years, We have not had a season as deadly as this season, both in terms of total numbers of cases, as well as deaths and liver transplants. So my answer to that is I believe this is probably the largest outbreak that we've seen in California ever. And then furthermore, there was another question about could this increase in Amanita mushrooms be due to rain, wet conditions? And I do believe there is a relationship there as well. These mushrooms tend to fruit in the rainy season. That doesn't mean they don't fruit in the non-rainy season, because especially with, irrigation, it's possible to see these mushrooms fruit at any time of the year. However, most of the time we see these mushrooms when the rainy season starts and through the rainy season, November, December, January, right in the time that we are currently, whether or not increasing, raininess or conditions are changing in the environment to increase the fruiting of Amanita phalloides. I can't say for certain on that issue.
Thanks, Dr. Smolin. Any information about which counties have had the deaths reported? Evan Bush is asking if these people died in the hospital, and I believe that all three of them did. Can you clarify that?
I can clarify that all three deaths did, in fact, they died in the care of a hospital. No one, as far as we know, we haven't had any reports of deaths that have occurred in the home. Most of these patients develop pretty significant symptoms and eventually seek medical care. And so the deaths were all in the care of physicians. In terms of the counties where the deaths occurred, it's a little bit tricky because many of the deaths occurred in liver transplant centers. So these patients may have started out in a community hospital somewhere and then were eventually transferred to a hospital that has specialized doctors to manage patients with severe liver injury. And the big liver transplant centers in the Bay Area include UCSF, CPMC, California Pacific Medical Center, and Stanford. And I believe that the deaths have occurred at UCSF and CPMC are the two hospitals that I believe, but I don't know. I can't say that with 100% certainty.
I was going to ask Dr. Rangan actually about liver transplantation. It's not something that I think there's a lot of general public awareness about it. Certainly something that we are very concerned about in toxicology and in medicine in general. Can you just share, just for the general public, what it means to have liver failure and then need a liver transplant and how that changes the trajectory of someone's life?
Sure, Dr. Vore. When it comes to chemical exposures that can affect the liver, there's many different kinds of chemicals that may cause liver injury. And when it comes to Amanita phalloides, this is one of the most particularly dangerous chemicals out there that you can be exposed to that can cause liver injury, and it can cause it quite rapidly. And what's really kind of scary about this particular mushroom is that it doesn't give you a lot of initial symptoms. So people can eat this mushroom and they can feel relatively okay for the first several hours after they ingest the mushroom. And then several hours later, maybe 12 to 24 hours later, you can start to see this rapidly progressive liver injury that can lead to liver failure very quickly. And that requires hospitalization and intensive care. And if it gets worse enough, then a patient may wind up on a liver transplant list. And getting a liver transplant is no easy task. Getting the liver to begin with is a difficult proposition. And once you do get a liver transplant, it's a very complex and involved surgery. And then after that, the first year or two after getting that transplant requires a lot of very sophisticated medical care in order to make sure that you don't reject that liver. So because of the severity of this kind of situation, because we as clinicians see these very, very bad outcomes from just incidental exposure to these kinds of mushrooms. That's one of the reasons why we are very focused on making sure that people who don't have the experience to not go out and forage for mushrooms.
Thanks, Dr. Rangan. Speaking of going out and foraging, Claudia asked and Dr. Smolin answered about, which geographic regions in California are considered high risk. How would you address that question, Dr. Smolin?
Well, I was just typing in the chat that These mushrooms are known to grow all over the state, and while here in the Bay Area is sort of an ideal environment for them, they've been found as far south as Los Angeles and maybe even points further south in the San Diego area, and north of here into Oregon, Washington State, into Canada, et cetera. So there's no part of the state that would be considered a, death cap free zone. You can encounter these mushrooms anywhere across the state.
Thank you. Any questions? Go ahead and either raise your hand or unmute yourselves. I'm also trying to go through the chat and make sure we addressed everybody's
A-
questions. Go
April
ahead.
Dombrowski has a question.
Oh, go ahead, April.
Hi there. Thanks again to all of you for hosting this call today. I was wondering if you could put the numbers that we're seeing here in the Bay Area in a national context. I'm not sure how much these mushrooms ever grow in other regions, but yeah, if you can offer how this compares to other states, for example.
I can take a crack at that. I mean, these mushrooms do grow all over the country. They can grow in the Northeast, even in the Midwest. However, I'm not aware of an outbreak even coming close to this number in any other state. I would say that our own not that I've seen reported. I would say that our own state's outbreak in 2016 is the next sort of lower number of cases that I've seen reported in any one kind of outbreak.
How many cases? How many cases was that in 2016? It was
That was
about
14. That was 14
14.
cases. Yeah.
Okay.
So is it
Um,
fair to say that this is the largest outbreak in the country that we've seen in the last 26 years?
I would venture to say that that's a true statement. To my knowledge, I have not seen an outbreak of this magnitude reported in any other state in the United States. Yeah. Um, This, by the way, is the same mushroom that was involved in Australia. So it grows on other continents as well. There was recently a high-profile case in Australia where there was an intentional poisoning with Amanita phalloides, and that took a lot of that there was a lot of media attention around that. So it's not just in fact, this mushroom originally comes from Europe, and it's thought that it came to the United States through contaminated soil and spread across the world that way.
I can maybe take the question from Mina about any impact in Santa Barbara County, San Luis Obispo, or Ventura County. One of the challenges we have is that we are able to identify where the patient is, where the hospital is that's providing care. It takes a little bit more to figure out whether or not they're a resident of that county where they're getting care. As part of our health advisory that we're pushing out later today, we have a map of California to indicate which counties had hospitals that had patients that they were caring for. And San Luis Obispo's, one of their hospitals was caring for a patient. We don't have any cases that we're aware of that were being taken care of in Santa Barbara or Ventura counties.
Yeah, and I know that part of the toolkit that we're providing in addition to the PSAs includes things like signage and flyers. And we're really encouraging, any agency, especially local health jurisdictions, but really parks and recreation agencies, national park agencies, et cetera, to really help us get the message out so that we can prevent poisonings, to let people know that death caps are fruiting right now and that foraging is a really hazardous activity. So hopefully, all of you on this call can help us spread the word, and we're happy to help provide those tools to our media partners as well, if you still need them after you've had a chance to look at the press release. And I see that Lupita had a request for a Spanish language interview. If we want, we can get a Spanish language section of our media availability right now, since Giovanni is on. So Dr. Giovanni Laird, would you like to just provide a Spanish language recap of what we've been talking about? And then we'll just do, if people have time to do Spanish language Q&A, we'll make time for that, because I think that that's super important for us to reach our Spanish speaking communities here in California.
Well, I would be in contact with all of you, and I thought of doing one interview, but now that I see how important this is, I think we should do like a special a roundtable discussion concerning this because I'm sure in the valley we're going to have problems like this if we don't have it now. Thank you.
Thank you so much, Lupita.
Hi, yo soy doctora Giovanni Laird, soy una farmacéutica con el Centro de Envenenamiento de California y hoy estamos hablando de un brote de hongos venenosos en el estado de California. Desde noviembre, el 18 de noviembre hasta el 4 de enero hemos tenido 35 casos de envenenamientos de hongos silvestres. Todos los casos eran gente que fueron en el bosque y piscaron los hongos ellos solos. Ningún caso es de una persona que fue a un mercado o una tienda o un restaurante y ninguna persona se uh, agarró envenenamiento en esa manera. Todos los pacientes fueron casos donde fueron a piscar los hongos silvestres ellos solos. Desafortunadamente hemos tenido 3 muertes y 3 pacientes que han tenido que tener un trasplante del hígado. Y por eso estamos hablando de eso hoy. Este es el brote más grande que hemos tenido aquí en California y el Estados Unidos, y por eso estamos avisando al público, por favor, no vayan a ir a piscar hongos silvestres en el bosque, aunque hay recursos en el Internet para identificar hongos silvestres. A veces esos recursos no son correctos y muchos de los pacientes también, muchos de los hongos se miran similar a otros hongos de su país, y aunque se miran muy similar, hasta el sabor puede ser similar, se puede envenenar. Entonces estamos avisando a todo el público, por favor, no vayan a piscar los hongos silvestres. Si ustedes tienen más preguntas o piensan que se han envenenado con un hongo o cualquier otro químico, puede llamar al centro de envenenamiento. Somos un servicio telefónico gratuito 365 días al año, 24 horas al día. Nuestro número de teléfono es 1-800-222-1222. Tenemos intérpretes disponibles. Hay uno de nosotros que hablamos español, pero por favor llámenos si hay alguna pregunta. Y por favor no vayan a piscar hongos.
Doctora Ler, buenas tardes.
Hola.
Una preguntita con el tema de los hongos. ¿Cómo la gente puede diferenciar entre hongos no tóxicos y hongos tóxicos si los ven por ahí?
Pues eso es el problema ahorita porque hay muchos hongos venenosos creciendo en este clima ahorita. Estamos diciendo que no deben ir a piscar los hongos si no eres un experto, porque sí sabemos que hay como aplicaciones en el teléfono, otros recursos, y si no eres un experto, por favor no vayas a piscar. Sí hay maneras de decir cuáles son tóxicos y cuáles no, pero ahorita es muy difícil para decir cuál es y cuál no es.
Gracias, doctor.
Great. Thank you, Dr. Giovanni Laird with the Fresno Madera Division of California Poison Control System. I don't know if Mina wanted any other questions addressed, but if you need us even after this session, then please feel free to reach out. I'm just looking through the chat. Is there information about people are foraging mushrooms to turn around and sell them? I hope that I got the gist of that question correctly. How do we want to address? I'm not.
I can I can
Go
address
ahead.
that. So in this specific outbreak, we are not aware of any situation where one of these mushrooms was sold, by a restaurant or even by, kind of a roadside vendor or something of that nature. I will say in previous years, we have had situations where people have foraged mushrooms and shared them in bulk with other people, and who weren't aware of where the mushrooms had come from, and did develop, unfortunately, had ingested Amanita phalloides and developed toxicity. So, but for this specific outbreak, we are not aware of any situation like that that's being described.
I think there definitely are vendors, for those who want to use mushrooms in their recipes. There are vendors at the grocery stores and the farmers markets, and they're vending safe mushrooms. So that's really where people, if you do need mushrooms in your dishes, go ahead and use those. Grocery stores, farmers market, mushroom retailers. Those are going to be much safer options than trying to forage and get mushrooms for yourself that you've picked, because that's what we're hearing about as the common activity that's getting people into trouble. And I think Evan has a question. Go ahead, Evan.
Hi, think in 2016, some of the patients affected were enrolled in clinical trials of silibinin, or I keep saying that wrong, but I was wondering if there were any clinical trials that involved the patients in this time around.
I can take a stab at that, Dr. Vora. Thanks, Evan, for the question. You're correct. I believe your pronunciation is correct, actually, silibinin, which is extract from milk thistle. I just want to say there is silibinin available through something called an investigational new drug. I'm not certain whether or not the patients are actually being enrolled in a clinical trial, but some of the patients in this outbreak have received silibinin. But one thing that I want to just stress is that there are a number of experimental therapies out there for this poisoning. But the single most important sort of intervention that we have is really prevention in the first place, because none of these experimental therapies have the evidence behind them to really prove to be efficacious in the treatment. And so many of these patients present to the hospital in a delayed fashion, sometimes greater than 24 or 48 hours after the ingestion, that we're really limited in the kind of treatments that we can provide at that point. Our goal is to really stress prevention in this particular outbreak. There are experimental therapies available and out there. There isn't a lot of evidence to support one over the other, and really that's why our message is, avoid ingesting these mushrooms in the first place.
Great. And April?
Thanks again. Do we have, I'm not sure if this is a question for Dr. Nguyen or Dr. Smolin, but do we know at all about the health coverage that the people who've been affected by the poisonings have? Are they covered by private insurance? Are they covered by Medi-Cal? And is there yet an estimate about how much this outbreak has cost the state in medical treatment?
I don't have the answer to that question. I don't know if Dr. Nguyen has any additional information. She's shaking her head no. So it's a great question, but I don't have that information at this time.
Thank you.
Just a quick announcement. If there are any media folks here who would like to request a one-on-one interview, I'm adding a contact for California Poison Control. Please contact Elaine Murphy if you would like to schedule a interview individually with one of our CPCS experts here on the panel. Thank you.
Thanks, Nelisa. I really appreciate everything that you're helping with as the leader of our health education program with California Poison Control. Evan, is your hand raised from before, or
Just a new question. I was wondering when the communications were available in Mixteco and yeah.
Did you say when it's available? Because we do actually have those videos already created. Is
Oh,
that
I
the,
was just wondering when that happened. At
oh,
what
what,
point during the outbreak were those materials created?
my team on the call might be able to give a date when they finalize, but I mean, I feel like we started working on it within a week of hearing details about the cases and understanding their backgrounds and language spoken. So we definitely started within a week, and I don't have an exact date of when we finished and published. One of my team members might weigh in if they're on and able to give that detail.
Dr. Vora, there's a question in the chat that says, are Amanita mushrooms only toxic if digested? I believe they mean ingested, or is there any sort of danger for anyone who comes in contact with them through other methods? And I can clarify, you do have to ingest this mushroom. It's not going to be toxic if you just touch it, brush by it, or something of that nature. It has to be ingested.
Yeah, great question. Any other questions or requests that we can help with? Otherwise, I was going to ask Dr. Cyrus Rangan to provide us three takeaways for wrapping up this session. And like I said, we'll always be available for questions, and we'll definitely update all of you as things develop. We feel like this is still a very active outbreak response, and we still have much more to do internally with our teams. But we're so glad that we were able to take this time and really address a lot of the questions that the public has that I'm sure all of you are hearing about. Go ahead, Dr. Rangan.
All right, thanks, Dr. Forrest. So just a few general comments based on all the discussion we've had today. First, thanks for everybody for coming, and we'll provide updates in the future as they come about. So just want to emphasize again that this is one of those situations where a small dose of an exposure can lead to a very, very severe injury. And that's one of the biggest reasons that we're so concerned about this here at the California Poison Control Center. And also just emphasizing again that these poisonous mushrooms and edible mushrooms can grow together, and they can look alike and taste alike. And so that's the biggest reason that we just so emphasize that if you don't have formal training, don't go out and forage for mushrooms, because you really never know what you're going to encounter. And if you're going to be getting mushrooms, the best places to go are going to be your grocery stores and your local markets, because those are going to be mushrooms that are not going to be poisonous. And then third and most important for us is that, give us a call anytime at California Poison Control, 1-800-222-1222, whether you are a member of a household in the general public, or if you're a healthcare provider and you have questions about a possible toxic exposure, we're here for you 24/7.
Wonderful. Thank you, Dr. Rangan, Dr. Smolin, Dr. Laird, and Dr. Nguyen. Really appreciate you and the expertise that you've been able to share today. Any closing thoughts or other comments?
No, just to emphasize that calling the Poison Control System or Poison Center is free. So free 24/7 access.
And with that, we'll go ahead and adjourn. If there's any other questions or anything else that you need information about, please feel free to reach out to us via email and have a wonderful day. Thanks, everyone.